Hello, my name is Melissa Humphreys, and I'm going to be discussing a case excerpt from the textbook Counseling Theory and Practice by Edward Neukrug, the second edition, and this is the case of Marcus, which is at the end of chapter 11. So, for some background on Marcus, he is a gay adopted um, man. He was adopted when he was a child, but he's now a man in the context of the case. And he has a partner, Rob. His family, his parents that adopted him are biracial. And his sister, Angela, is um, a birth child of those two parents that adopted Marcus. And then he has a sister, Lillian, as well, who is also adopted. So that's Marcus in a nutshell for now. And let's see. So the reason Marcus is going to counseling, his partner Rob had moved away for work, just for a short period of time. But this sent Marcus into a bit of a spiral of anxiety, maybe a little depression, as his sister Angela said that Marcus was found just kind of like avoiding all of his work, staring at the ceiling, not really finding joy in much. Um, so the scenario in the case of the context as written, the context of the case as written is that Angela is Marcus's sister. She's bringing him into counseling with a counselor named Mike. And so Marcus has a trusted doctor, Dr. Bertram, and she was not available at this time, Angela said, so Marcus is now seeing the counselor Mike. And my perspective on this is, so Mike is a reality therapist, which I think I'll further discuss how that'll be beneficial for Marcus. But I do think that because of the previous connection with a trusted doctor, that it might be it might be prudent to ease into the therapeutic relationship with Marcus. Perhaps ask permission to contact Dr. Bertram, just so we're on the same page about his care, and to try and see what's going on with his sister caretaking him in such a way, which we'll get to later. So, to ease into the therapeutic relationship in general, I think it's going to be very important to help Marcus focus on his internal control language as to not start depending on his therapist. So Mike does this pretty well in the text on page 429 in Neukrug's textbook. Once again, it's Counseling Theory and Practice, the second edition. So Mike explains how Marcus feels controlled by others and the outside events in his life. Marcus uses a lot of if only language. If only this happened, then this would be better. He also tends to rely on his relationship. So a specific example of this is Marcus seems to feel that he needs Rob around in order to be able to complete his comps for his PhD, or to just kind of generally function. And it's also important to note that this move happened because of work, even though it's temporary. This insight gave Marcus some feelings of abandonment, it seems, in that, what's going on with the relationship? What does Rob think about the relationship? So, with that said, it's still a very external focus instead of the internal focus of as Marcus, what can I do in order to ask Rob about these more directly? So we'll get to that later. And so in the position of Mike as a counselor, I would focus on helping Marcus express his role and how he's responding to his environment and himself, with his thoughts, his feelings, his actions. And I think that would empower Marcus to begin to make choices that are better aligned with achieving the goals that he wants. On page 429, Mike discusses with Marcus what his quality world would be, like his ideal world, and how to kind of get there. I think could be reality therapy could really help it's an attainable quality world. Marcus really just wants, to have some stability in his family life, especially with Rob. Um, so, and we'll further dive into that later. So, if I were to continue as Marcus's reality therapist, I first would try and do my best to help him differentiate between his wants and his needs. And I would do that by addressing the 5 basic needs of humans as seen through reality therapy, which is to survive, to love and be loved, to feel empowered, and to have freedom and fun. So that will be the context, and I think clarifying Marcus's needs versus his wants will help his internal control language. It would push him to better understand what these feelings and drives are. Is it a want? Is it a need? And oftentimes we'll fill our needs as we'll see them as wants sometimes, or we'll fill them with habits too, because they are a need. And I think that it'll make Marcus a bit more aware of these habits surrounding his needs and how to both provide himself that which he deserves as a need, and also realize his wants and how to effectively achieve getting those wants. So Mike does this pretty well on page 430 of the textbook. Mike expresses needs seen through reality therapy. So the only thing that I would do differently is the way Mike approaches it's almost a transference of what a need is for Marcus. So Mike on page 430 does kind of generalize Marcus's experience and says, oh, you have a need to want to be loved and feel loved, or to love and be loved. And I wouldn't necessarily point it out in that moment. I would wait for neutral moments to discuss what the principles of reality theory are, and then hopefully as the relationship continues with Marcus, the therapeutic relationship, there will be enough trust where we can openly discuss those 5 needs in the context of Marcus's life. That would, I think it would empower Marcus even more and have him be independent on his mental health journey, instead of relying on me or Mike or a counselor to kind of, be the little like light bulb, or like, hey, so this is what this is. You're saying these things, and what it sounds like to me is you want to love and be loved. Which I think is a better way of saying it than the way Mike puts it, which is just directly, that's a need to love and be loved. So anyway, I find it would be helpful to help Marcus differentiate between his wants and needs for himself, instead of projecting the reality therapy principles onto him. And so that would be the first step of WDEP therapy: wants, direction, self-examination, and practice. So I believe once we circumspectively clarify Marcus's wants and needs together as a team, Marcus and I would be able to move into the D in the WDEP theory, which is direction. So setting up goals. He already discussed his quality world with Mike. So really better understanding how to get to those goals. And through the process of understanding his motivations and goals, we can get to self-evaluation with accuracy and a greater locus of control, as established by like being able to caretake his own wants and needs after identifying them, instead of relying on caretakers such as Rob or his sister Angela that he mentions often throughout the discussion. So at the bottom of page 429, this actually begins to happen, where he's starting to take a little bit more responsibility, accountability for his situation. He gets himself to therapy. It was pushed a little bit maybe by some tension between his sister. and his sister about his sister caretaking him. I can't, that's just an assumption. I don't know that for sure, but based on the text, he was able to get himself to therapy with Mike. So that was really good practice of that internal locus of control. So hopefully that then could be generalized to other relationships, like his relationship with Rob, where he feels he, can't do anything, he can't complete his PhD comps, he has all this anxiety about how Rob is feeling, all of these unanswered questions that Marcus seems to be answering in his head and then projecting them onto the relationship. So helping Marcus formulate direct questions or direct honest analysis of his feelings around Rob and from an internal control state would, I think, really be helpful for Marcus in his in being effective to get the things that he wants and needs in the way that he wants and needs them. So, multiculturally, I think it's really important to just note, like I said before, Marcus is adopted. He's raised by a biracial family in the United States. His sister is, a birth child. Angela is the birth genetically related to his two parents, and then he has an adopted sister, Lillian as well. So just understanding the context that Marcus is in, taking it easy with him, and for him to open up culturally as much as he wants, and to just respect and appreciate him as a human being. So, but just good to keep that multicultural kind of perspective in mind. And then finally, implementing rational emotive behavior therapy in tandem with reality therapy, I think would be very helpful. So REBT could help Marcus examine the way he's thinking and feeling about various situations he's in, and also work on honing those skills so that he can use them in the moment of a situation. So definitely the antecedent behavior consequence ABCs of feelings and behavior. I think that would be key. Maybe even doing a few worksheets with him on that, giving him some worksheets to do in the moment. That could be helpful too, if he's up for worksheets. If not, there are apps. There are so many ways to track these moments of ABCs. And then to help him with rational scientific examination of those feelings. So I have a few books that I would offer for him to either borrow or to give certain copies of pages to. It's particularly Plato, Not Prozac, by Dr. Marinoff. There's also Healing Emotions and Destructive Emotions by the Dalai Lama, and a whole slew of professionals actually within physical and mental health. But it's written and edited by Daniel Goleman, both of those books. So I would definitely encourage Marcus's journey to have that internal locus of control, to discuss the destructive emotions, the healing emotions that are accessible to him through the books, the Daniel Goleman books I just mentioned, and then to scientifically examine them. The Plato, Not Prozac book does a wonderful job of explaining how the way we think is going to affect so much more than just taking medicine. It's also important to be aware of thought processes. So I think that would be really helpful for Marcus in his journey. And in general, my goal is always to help individuals feel empowered and be independent in their mental health journey. I just would like to guide to different possibilities for healing, and whatever clicks, clicks. So for Marcus, reality therapy and REBT, they both work well, and I would just ensure that, whichever is producing the desired internal change for Marcus, the internal change that he wants and the effectiveness in his external world that he wants, then my job is done. So thank you for your time, and hopefully I can't wait to hear what everybody else has to say about this case, and have a further discussion about it with everyone. Thank you.